it's shocking that over 20 years of practice, systems are actually deteriorating, that instead of improving and finding what works, that they're actually getting worse. We have, more areas where there is an absence of providers. When I was a medical student over 20 years ago, I worked in a group. I was taught to do my deliveries by a midwife. We had nurse practitioners, midwives, and OBGYNs who took care of the more high-risk patients. We would meet on a weekly basis, go over all patients that we thought were high risk, address any issues, and work together. We have this discrepancy between care of African Americans, patients with disabilities, patients with different gender identities. I could go on. Patients with lower socioeconomic status. There is a need to understand the nuances between sex, gender, employment, socioeconomic status, access to any primary care provider, be it a midwife, a nurse practitioner, an OBGYN, even a primary care physician. It shouldn't be that healthcare should only be for those who can afford it. I think healthcare is a right, and I think, again, that women's issues when it comes to healthcare, not just in our maternal care, but just in general, we need to make sure that we put that gender health, equality at the top of the agenda. And all of us, not just the physicians, not just the scientists, but all of us as communities, as entrepreneurs, we need to make sure that we bring this to the forefront.